Good morning and welcome to the second of 3 events this week as part of the What Works Festival of Learning. My name is Áine Kerr, a broadcaster and entrepreneur. It's my pleasure to be your host again this morning for the second of, as we say, 3 events. As many of you know, this is now the third year of the What Works Festival of Learning, and this has really become a space over the last 3 years for all of you to share knowledge and ideas from international case studies and from here in Ireland as well, to really talk about the best practices in prevention and early intervention, and to really create a space as well for all of your professional learning and to remain curious about the fields that you are also committed to and purpose-driven about. And we hope this morning we will continue to really inspire all of you into action, that you're going to leave over the next 60 minutes with insights, ideas, new case studies, new reference points. So this will be practical in terms of the knowledge, but also inspiring. But also, if nothing else, and I think we really felt this here on Monday with our audience, was really that sense of connection between like-minded experts and people who really care about children and young people in Ireland and across the world today, and all of the challenges faced by them, their families, their guardians and parents and support systems. What Works is an incredible initiative that is designed, we should say, by the Department of Children, Equality, Disability, Integration and Youth, and it is funded through dormant accounts. And to be a part of the conversation today for the next hour, for you, our online audience, the more this comes from the outside in to the 6 incredible speakers that we have today, we want your questions. As usual, go to the Q&A function at the bottom of your screen. We'll be monitoring your comments, your questions for the next hour, and we'll make sure we've got 15 minutes at the very end to pose those questions to our 6 speakers today. We'd also love to draw attention to all of the conversations and to this, the second of 3 events this week online, whether that's LinkedIn, Twitter, Instagram, across social media, using the hashtag Partners in Prevention. Please do tag the What Works handle, do tag the Department of Children, just so we can draw attention to everybody's great collective work. And we talked about on Monday, for those of you who are rejoining, that this should be a space for the next hour that is all about getting out of the weeds, and for the next hour up onto your balcony and thinking about that difference between the sowing and the harvesting. Every day we go to work, we're doing business as usual. It's about harvesting the crops, getting the work done, making sure we're accountable for the tasks and procedures and processes that we put our hand up for. But we all, as collective leaders in our fields, had to make sure we're always sowing the fields and crops of the future, that we're innovating, we're being creative, we're ideating, we're experimenting, we're learning, we're staying curious. So I want you to think about that for the next hour. Ask yourself some hard questions about what does it look like for you to play bigger as you listen to these experts? How can you do more? How can you learn and iterate and be creative in your field? So with all of that, I mentioned we have 6 speakers today. Joining me here in the room in Dublin from the Ashling Hotel in Dublin City Centre, I've Ciara Pigeon, who's joining us from the Department of Children, Equality, Disability, Integration and Youth. I also have Jerry Cullen, who's the Programme Manager for City Connects. On screen, you can see Arlene Forster, who's the CEO of the National Centre for Curriculum and Assessment. And we're also joined on screen by Derek Chambers, General Manager, Policy Implementation for the National Mental Health Operations. But I'm going to go first to Wadid Maouf, who's joining us from Lisbon from a conference. And Wadid is representing the United Nations Office of Drugs and Crime. And Wadid, as you're all going to hear and see, is an incredible public health professional, originally from the Lebanon, with a PhD in mental health and drug epidemiology from Johns Hopkins School of Public Health. He joined the United Nations Office on Drugs and Crime, first in Cairo in 2006, supporting health responses to drugs in the Middle East and North Africa region. As of 2010, he coordinates a global programme on prevention of drug use, HIV and violence from his headquarters in Vienna. So Wadid, to come to you first, and greetings from here in Dublin, Ireland. I know that for your office and your team, you're working across 17 sustainable goals, and I don't expect you to speak to all of them today, but I know one of the core goals in there is good health and well-being. Can you just talk a little bit and set the scene for us when it comes to the United Nations Office of Drugs and Crime? How do you engage with and support policymakers?
Thank you very much, Oni, and thank you for the introduction and for having me on this interesting panel. As UNODC, as the Office on Drugs and Crime, we are an office that is specialized in the issues of drugs and crime at the service of member states. We are governed by two parliaments, if you want, of member states, decision makers in terms of your country is implicated. So one is on drug issue and one is on crime issues, where this committee, this parliament of member states sets the agenda moving forward in terms of priority of taking actions and put resolution in terms of how to address the challenges of drugs, the challenges of crime globally, and request UNODC's technical assistance as well as normative assistance and an assessment and maybe like assessment of the situation to address these issues. Now, under the drug portfolio, we advocate for health and human-centered response to drugs that is scientifically supported and balances, supply reduction with demand reduction measures, but also really focuses on maintaining access to substances on international control for medical purposes. So I sit within a section that really sort of work and responds to the member states on issues related to prevention, treatment, and rehabilitation as a section, responses for drugs. Mostly my work is on prevention, and under the prevention we have, so basically you can see that there's a very big political umbrella behind this. There are political resolutions that the member states have a commitment to apply, and they request assistance in terms of how to implement it. And in the field of prevention, this is where we sort of capitalize on this opportunity of having that affinity of member state to provide them with what the science is in terms of prevention moving forward. And as you have rightly mentioned, we are in an era now from 2015 to 2030 where countries are working on also beyond their commitment to address the drug issue on sustainable development. These are 17 different goals. Goal number 3 is on health. And there's a specific target on health that is 3.5 on strengthening prevention and treatment response to drug use. And it's an important secondary, but very important political gate of entry where member states realize that prevention of drug use is not only addressing a healthcare need or a human health need, but it is a core component of sustainable development of their own countries and the world. And within this umbrella, we just try to refocus their attention, that political momentum that exists, into a science-oriented. It's not anything that is done is prevention, but there's a science behind prevention, and we try to guide them by development standards of prevention so that policymakers, when they're engaged with this momentum moving forward, with that good heart moving forward, would know what works, what does not work, how, in what context, so that they have a more programmatic approach.
And Wajid, as you're trying to direct political attention to key priorities, it feels like in this moment we're living through something of a perfect storm, unfortunately, in some ways. We look at poverty, we look at cost of living, war in Ukraine, climate change, like so many different issues. Like, what are maybe some of the key trends? What are some of the key priorities that you're really focused on right now underneath that goal of health and well-being?
A very important question, Anya, because many times policymakers perceive that they have a mental state in terms of addressing drugs as the issue, but they don't have that larger perception that initiation to drug use is not a result of a personal free choice that, especially children and youth can say yes or no to. But there are vulnerabilities that exist at the individual level, from mental health challenges to cognitive development to reactivity to stress to genetic composition as them as a person. But that person also exists within layers, social, ecological layers, with families that might have challenges, with schools that have challenges, communities, peers that have challenges. But even these social structures also are in a larger vacuum. And this is the core of your question, Anya, in the sense of a family, of course, has certain priorities, a certain role to play with vis-a-vis a child. But, a family also lives not in vacuum, but has a context behind it. Currently, that larger context around these social structures and around the individual with the rising level of conflicts, economic strains, social inequalities, accessibility to drugs or lack of accessibility to substances for medical purposes, the COVID-19 pandemic, all of these things affect the individual with their own sets of vulnerability and affect the structures around them. So we try to reshift the policymakers' attitude rather than just discussing what drugs are, their dangers, which is a small slice of the problem, to really focus how to support the individual resilience and the structures around the child to grow in a healthy and safe way.
So to hone in now very specifically, Wadid, on the context there that you speak of drugs and substance abuse, I've heard and seen you say before that this does require an evidence-based substance use prevention strategies. It calls for a shift in what you call the response paradigm that focuses on the people rather than the substances. Can you talk a little bit about that philosophy?
Exactly. That's the core component, and I think it goes back to why strengthening prevention in that context is linked to sustainable development. Because now, when you're focusing on the person, because when you're talking about drugs only, you can talk with a specific age group, with a specific subpopulation of this age group. But when you're seeing holistically in terms of building resilience against vulnerability at the individual level and the ecological layer around them, you're talking about safe development of youth, then you can start applying the science of prevention as early as when the child is in the womb of the mother. And there are intervention by then. And every single age of development, when the child is born but is unable to speak, can be supported in terms of have a positive socialization context. When the child speaks and is not yet in school as well, there's another set of development in terms of cognitive and other needs that maybe for the sake of this conference, I won't go into details, but there are packages that can support this. When the child is in early ages of school years, there's another set of milestones of development that can be assisted. And so basically you're starting addressing that vulnerability so early in the person and in the context around them that in reality, you're not only preventing drug use, but you are building a stronger, more resilient generation that is, you're preventing violence, you're preventing school delinquency, you're preventing mental health, and so many other issues. And that's the core element in terms of that change of paradigm. The cost effectiveness and the return of investment on it becomes broader and is linked to sustainable development.
Yeah, so it's two-pronged. You're trying to prevent the dependencies in the first instance and helping people ensure that they don't develop those disorders. But that is in parallel to the holistic self then, as you say. I imagine in all of that, you're having to think about parents, Wadid. Like, it's been a core theme through this event over the last 3 years. On Monday, we had Parents Plus here speaking very, very passionately about peer-to-peer networks for parents. When you think about the parental support, can you talk a little bit about just, I know some of this might be for parents in crises and trauma, but I think the tools are still important and relevant to an Irish audience here, just how your team have gone about supporting parents, in particular those, as I say, in crises situations.
Yes, in the context that I just described on you, we're talking about, when you talk about development, you can appreciate that out of all the social institutions that I mentioned, family is a kind of a breed by itself, because the member of that social institutions share genes, share a history, share a future together, unlike any other a teacher or a social worker where they have, an important role, but their relationship with each other is different. So that's why in the context of development, we focus a lot on the family skills sort of development, family skills that adapt at different ages of development. And all families, as you mentioned, regardless of the context they are in, there's a certain, and just to clarify, because I'm from the Office on Drugs and Crime, we're not talking about families recognizing if their kids are using drugs and being law enforcement officers within the family, but we're talking about really the skills of communication, bonding, how to set limits, but contain a loving relationship with the child, that affection, that positive affection, how to communicate, to problem solve, and that will evolve in different ages of development. That's universally. All families can benefit from this, and we have tools to support family skills regardless where you are and the context that you're living in. But you zoom in on an important context now, we have a very large number of families that are, COVID-19 made us all parent under stressful situations, as I mentioned, but also there are parents that are facing particular challenges in terms of caring in conflict, in displacement settings, in humanitarian setting that might be linked to conflict, might be linked to climate, might be linked to social inequalities context. All of these things make the normal parenting shift to a different level of vulnerability where the caregiver themselves need to take care of themselves, and at the same time play a role of a safety net in children, where also these children are facing a vulnerability that is different than just the age of development they are in. So we have a set of tools for caregiving in such contexts, and these vary from simple things as tips, leaflets that parents can actually read themselves so that they would recognize their own stress, read the stress on the children, remember specific techniques that they need to account for in the context that they are in, to more detailed booklets where they can read them in more details, to packages that are more interactive in the sense of now we're no longer taking the parents themselves reading the skill. We appreciate learning a skill requires somebody to support you. So there are facilitators that can be trained, work with families in terms of really through play. The child on one hand appreciates what the skills are in the parents, and the parents, so the relationship is built through these packages. Strong Families, for example, is an example of a tool that's designed for parenting in stressful situations, up to, if you see, if you visualize it as a pyramid, of course, when we talk about crisis situations, there's trauma exposures, and trauma affect caregivers, affect children beyond just the normal stress of the crisis that they are in. So after addressing trauma, we have also packages that address trauma while at the same time rebuilding that relationship between caregivers and their children. An element of this is translational science, where we have documented that the developers of these programs exist in one country, mostly developed countries, where it has been researched, but we have worked also in terms of documenting that this sort of science exists and can be translated to the countries we're engaged in beyond this.
That's brilliant. And for anyone who wants to check out any of those tools that Wadid has mentioned, if you do go to the website of the United Nations Office of Drugs and Crime, you'll find there's Strong Families there, Family United. There's a lot of self-help tools as well to help families continuing to deal with the after effects of COVID. Do keep your questions coming in for Wadid and everybody else. Wadid, thank you for that. We will be coming back to you shortly as we go through the audience questions. I'm going to move now to Ciara Pigeon here in the room, who's the Principal Officer for the Department of Children, Equality, Disability, Integration and Youth. Ciara is responsible for the cross-government coordination of policy direction, activity and performance relating to parenting support and related family support initiatives. And Ciara has led out on the development of Supporting Parents, the national model of parenting support services. And maybe, Ciara, that's where we'll start, building on Wadid's last themes there on supporting parents. We know you've got 23 actions that you're working through under the Supporting Parents. But can you kind of maybe link some of the learnings, insight from Wadid there to what you're working through with Supporting Parents, unique to the Irish case at the moment, and just some of the learnings to date?
Yeah, no problem, Anya. I'll do my best. I think, and particularly listening to Wadid speaking, it's really important to recognise that there are things that work. Very often in the prevention space, successful prevention can be invisible and we don't talk about it and we see the problems in the news and that. But to know that there is a science behind this and there's things we can do is just, so important. And we need to recognise that and celebrate it. With Supporting Parents, I suppose to go back to Wadid's piece as well, Supporting Parents is very much about ensuring that parents have those tools, those supports, that their children are in the right boat for the journey that they're going to make. But there's also that wider point. So Supporting Parents is focused on those needs and at an individual and family level, while at the same time we also need to improve the river for people as well. But to go back to Supporting Parents, we have a number of really great pieces of work underway. We have research going on into home visiting services in Ireland to understand what we have, the outcomes that they're supporting, And that can be hard to measure because those outcomes are across the course of a child's lifetime and aren't just immediate. So we're looking at that with a view to trying to understand what we have better and develop more policy around home visiting supports. The other piece of work that we've just been doing recently is around parent peer support and supporting and encouraging that. So we've launched a funding scheme, and we know from research that parent peer support is really vital for people, particularly as part of the research we did and consultation. There are some groups of parents and the particular challenges or circumstances they find themselves in. It can be a very lonely place, and peer support can be a key element for those parents in being able to, understand the supports that are available, access them, and support each other. It's not all about providing services just to parents themselves.
What's the process for that specific funding initiative now for the peer-to-peer?
Well, I suppose we already have, we've long established funding for parent and toddler groups in this country that work really well. But we recognise that there's lots of other groups of parents who may also benefit for having the opportunity to come together to discuss their issues and circumstances. So we've modelled it a little bit on that, and we've received really positive response and a very large number of applications. So we look forward to getting that money
filtering
out next
through
year.
that.
Yeah.
And building then on Wadid's specific points then about the prevention strategies and approaches when it comes to drugs and substance abuse. Can you talk a little bit about our prevention work here under the National Drug Strategy? If we're taking a similar approach, that it's about people, not the substances. It's the person, the holistic person, as opposed to just the substances.
Indeed. So our National Drug Strategy has a really strong focus now on the prevention piece and children and families. So earlier this year, the Department of Health launched funding support to develop and look at more preventative approaches at a much earlier stage in a child's life. As Wadid said, well before a child may encounter drugs. It's about making sure the relationships are right and that the underlying reasons why a child might, or a young person might use drugs are addressed far earlier. So it's great to see that type of work. It's great to see that recognition in other government departments, not just our own, about the importance of prevention and early intervention.
Yeah, and that's the key, and it keeps coming up. But every time we bring a group of smart people like you all together, is that need for the cross-government, cross-functional collaborations between government departments. And one of the themes that Hannah, our keynote speaker on Monday, talked about was this idea of a seamless state and how you need government departments matched up, from even the moment of birth, that a system kicks into action, in terms of the supports and systems around it. And I wonder, is that something you're thinking a lot about? Because one of the points of feedback we had from Spun Out and Parents Plus was that a lot of these supports and funding mechanisms you're talking about today exist, but do we have to do a better job sometimes at marketing, educating, ensuring that there's a one-stop shop that parents can access and see what's available to them?
Absolutely. I think one of the starkest findings we had with consultations with parents was parents saying they found out about a support 2 years after they needed it. So, there's definitely a lot of work to do in making sure people know what's available. The example we had the other day from Estonia was just so inspiring, where they use certain key points, whether somebody's applying for a particular financial support or at a particular life stage, whether that's a child starting school or something like that. They use those key points to then provide information about other relevant supports. And I think that's a really, really great way of looking at it and making sure we wrap services around parents and make them as easy as possible. I was reflecting on that since Monday, and there's one service I really love. The Road Safety Authority do that Check It Fits service for parents, which is great.
Yeah.
People with cars and children also interact with our system when they pay their road tax and other things. And maybe there's opportunities there just to make it that bit easier to let parents know that support is available and can be easily accessed.
Glad to hear that's something you're noodling on since Monday. Can I ask just as well, Ciara, like one of the last pieces of research I saw through yourselves and supporting parents, was just on the questions of how parents feel. Now, this was back in 2018, so I'm not sure if there's any research since, but that research at the time, and this is pre-pandemic, was showing 4 out of 10 parents in Ireland felt worried or stressed in relating to parenting, always or often. Like, that's a stressed out generation. How do you think they feel today, and what do you think some of the problems associated are? We've identified one there in terms of just the knowledge of what's available. What do other parts of it look like, do you think?
I think we have to recognise the broad context in which people are parenting, and there are pressures there. There's expectations, unrealistic expectations that people may feel disappointed at not living up to. So I think we have to be careful in our communications with parents. I think most of us recognise the importance of those early years and getting things right, but we need to balance our message to parents, and if we're telling people that the early years are important, we also have to provide the supports for that. And there's a lot of different factors there. Like I think our leave provisions improving is helpful. But there's lots of other pieces that all have to fit together. And I suppose that comes down to there's no one action that prevents a bad outcome. It's about all of us working together and getting all those pieces of the jigsaw in place, at the right time.
Okay, great. Thank you for that, Ciara. And a reminder to our audience, get your questions, comments coming in through the Q&A function at the bottom of your screen. I'm going to go now to Arlene Forster, who's the CEO of the National Centre for Curriculum and Assessment, the NCCA, and she is definitely one lady who's talking a lot to parents at the moment. The NCCA, as most people will know, works with learners, teachers, practitioners, parents and other stakeholders to develop research-informed curriculum and assessment. Arlene began her career as a primary school teacher and joined the NCCA in 2001. Arlene has led work in areas such as curriculum review, assessment, reporting to parents, language, mathematics, science and development of ASHTOR. And ASHTOR is the Early Childhood Curriculum Framework. And Arlene, congratulations. It's 2 years ago now, but you were recently appointed CEO, so hopefully you're emerging from the fog of war. And one of the first things that you have set about doing is the review of ASHTOR, that early childhood curriculum. Can you just talk about that process? Because I know this is something everybody has to do at different points. You have a big policy initiative, now you have to go and review it, and you're kind of leading what you're calling this purposeful engagement. What does that look like in reality when you're trying to get the public, parents, children to engage in a review?
And thanks, Anya. I suppose that just maybe before I answer that question directly, I suppose maybe just to say that, I mean, ASHTOR it's 13 years old this year. And I think what becomes really important, just thinking about what Waddy and Ciara have both spoken about, I suppose when I think back to when ASHTOR was developed back in the noughties, it was developed in really close collaboration with the sector. And I'm going to come back to that in a moment when I speak about the current work. But I think it was developed in such close collaboration with the early childhood sector that oftentimes it is described as the curriculum framework developed by the sector and for the sector. So fast forward 13 years to today, I suppose what we're doing now with ASHTOR is we're essentially checking back in, and we're doing that for two reasons. One, given that 13 years have elapsed since the publication of ASHTOR, we're essentially asking two questions. What is working well with ASHTOR, and maybe what do we need to look at updating? And the reason we're actually asking those questions, it goes back, I think, to something that Waddy drew our attention to and Ciara built on it, and that is about a focus on the whole person. On young children from the very earliest moment in their lives, because ASHTOR is a curriculum framework that supports young children's early learning and development, irrespective of what setting they are in their early childhood. And we know in Ireland that children can be in, lots of different settings. So that's the ultimate purpose, I suppose, of ASHTOR. So we're checking back in now, and we are asking, what needs to be updated, maybe what's not working so well. And we're doing it, I suppose, in a couple of different ways, Anya. Collaboration and partnership are still very much at the centre of how we're doing this. So there are a couple of strands to the work. We've just come through, I suppose, what we talk about as being the phase 1 of this work. And that basically has involved a really extensive consultation with the early childhood sector. And I say the early childhood sector in its broadest sense. So we've been out and about talking to people, practitioners, to children themselves, parents, different, I suppose, organisations who are involved in this space. And I suppose we've done that in a number of different ways. I suppose one of the things that has changed over time since we developed Aster, and that is, I suppose, we've continued to evolve how we consult and work with people. So in the recent work in checking back in with Aster, we have used lots of different consultation tools and formats from, I suppose, the surveys that we're all used to filling in and have done for many years. But we've also put a lot of energy and time into conversations with people. So, bilaterals, focus groups, and that has given us a chance to really get into the detail of, I suppose, people's lived experiences of working with Aster. And a really important part of that has been asking children, what do they think is working well? What do we need to think about maybe slightly differently? And I might just maybe say a little bit, Anya, about that work with children, because I think sometimes when people maybe hear about us consulting with children in early childhood, people might kind of be wondering, how on earth do you do that when you think of young children from birth through to 5-6 years of age? And I suppose this is where, you need to become really creative and innovative in terms of how you go about gathering children's perspectives. And we did this back in the day when Aster was developed, and we're doing it now again. So in terms, I suppose, how has this maybe taken place over the last couple of months? We were very fortunate to be able to commission out this particular piece of work. And I want to acknowledge, I suppose, the consortium that has been involved in this, which is Maynooth University, Stranmillis University College in Belfast, and Early Childhood Ireland. And they've done really innovative work in trying to tap into the voices of children. So I think it's 169 children in total who have, I suppose, shared their experiences with us. And they've done that in a lot of different ways. So, methodologies such as the use of puppets, the use of role play, analysing children's play, conversations with children, children's drawings, photography. So really creative methodologies to try and ascertain, what do children think of their experiences in early childhood settings guided by Aster? And out of all of that, that will help to shape, I suppose, what we identify as being the key things that are both working really well, but also the key things that we maybe need to give a bit more attention to. So the idea, Anya, is that we would then use all of that feedback. We would then, I suppose, develop a set of proposals for the updating of Aster. And we will go back out again then at that point, and we will consult with all of those who I've mentioned as part of our work in ultimately arriving at an updated framework.
It's a long but very thoughtful, detailed process and very collaborative, and you've the voice of the child in there. I wonder to what extent, Arlene, are you finding any tension between the original founding principles and values of Aster 13 years ago and trying to kind of forecast for a changing world, but there's so much of the world that is ambiguous and unknowable to us, and how do you plan for what is unknown and yet stay rooted probably in some of the original values of it?
Yeah, a really good question, Anya. And actually, I think what strikes me, I suppose, first of all about that question is, I suppose, some of the conversations we had way back, 15, 16 years ago, when we were actually developing Aster at the time. And I suppose a lot of the conversations at that point really touched on, I suppose, got to the heart of what the sector values most when you think about young children and what's important for them, and what society, I suppose, values most in terms of, the experiences for young children. And the reason I'm saying that is in the work to date now in checking in and updating Aster, one of the things that is coming through the conversations we've had and the data we're gathering is that, one, I suppose, that the literature around children's early learning and development. And the literature, I suppose, that points to the importance of things like supporting young children's well-being, supporting their sense of identity and belonging, supporting them as communicators and thinkers. Those themes, or those, I suppose, priorities for young children still stand true today in terms of the literature and the research that has taken place in the last 13 years. And I suppose out of that, then, the principles, and there are 12 principles in Ashler currently, those principles very much still stand up. Now, there are things that people are pointing to that we probably need to give more attention to. And I think in the main, those things probably reflect how our society has actually changed in the last 13 years. So there have been conversations around, the need maybe to put an even greater emphasis on inclusion and how we meet the needs of all young children in their early childhood years. There's been, I suppose, references to how our society has changed and some of the real challenges we now face as a society and as a global community. And I think Wadi, already referenced the focus on sustainability. Climate action is another one, social cohesion. So I think the things that are popping up, Anya, they're not hugely surprising to us. I think what's important is we've created a space to allow those conversations to take place. And certainly there's a lot there now for us to chew on and to think through as we continue to work with the sector now to, I suppose, identify, well, what does this and what should this mean for an updated framework? So I think we're very satisfied and actually we're delighted to see that the principles themselves still very much ring true today. That doesn't mean there won't be tweaks along the way, because I suppose another important piece that we have our eye on, and it goes back, I think, to you used a lovely phrase, Anya, which I wrote down here in case I've forgotten it, a seamless state. And I suppose we're very conscious that a seamless journey for young children through education is also really important. So as we're updating Ashler, we're also keeping an eye to the redevelopment of the primary curriculum, because obviously, our young people will move from having their experiences shaped by Ashler into primary school and having their experiences shaped by a curriculum there. So alignment and continuity becomes really important there as well. And that's another piece that we're very much keeping our eye to as we update Ashler.
Great. Thank you for that, Arlene. Keep your questions coming through the Q&A function at the bottom of your screens. For those of you interested, because we've mentioned it a few times, that seamless state concept, there will be a recording on the What Works website of Monday's event, where our opening speaker from Estonia, a minister in the respective department, to Minister Roderick O'Gorman, talked about this concept of the seamless state. It was absolutely fascinating for anyone who wants to watch that back. I'm going to go now to Jerry Cullen, who's the programme manager in City Connects. Jerry has worked in the north inner city of Dublin throughout his teaching career. He spent 23 years working in Mount Carmel Secondary School, where he was employed as a teacher, homeschool community liaison coordinator, and more recently as school principal. In October 2020, he took up a seconded position with TUSLA Education Support Service to lead a new initiative in the NEIC. Jerry is currently programme manager for the NEIC City Connects pilot project, which is in its third year of implementation. And we were joined in the first year of this conference by your colleague Mary Walsh from Boston College. Maybe as a recap, can you just in a minute tell us what City Connects is?
Yep, I will. Thanks, Anya. City Connects is a comprehensive system of student support. So it was established in Boston College back in 2000. So it has over 20 years of research and data to show that if you put the right plan in place for the right child at the right time, it can change the outcome for that child. So I suppose it's an evidence-based programme. We're trying to address all those out-of-school factors that some of the speakers have spoken here today. We're talking about housing instability, food insecurity, maybe difficult family situations. COVID, of course, is another factor that has, impacted on children, as well as sometimes a limited access to enrichment opportunities for children in disadvantaged areas. So we're trying to address those out-of-school factors. So what's unique, I suppose, about City Connects is that as teachers, we're often trained to look at what children need. And we do that with City Connects, but equally we look at what they are good at. What are their strengths? Because we have a firm belief that if we are building on those strengths, other things will happen, alongside that. And we look across 4 domains when we're reviewing children. We look at the academic domain, we look at social emotional behaviour, we look at family, and we look at health. because I think we all agree they all interact with each other and they all affect each other. And the children cannot do well in school alone if there's issues with health, or if there's issues with family, or there's social, emotional behaviour problems. So in a nutshell, what we do in our system is we review every child every year. And again, that's unique. It's for every single child in the school. It is not just for the troublesome one, it's not just for the children who are struggling, it's for everybody. And I think the teachers are finding that refreshing, because they're in the classroom, they're busy all day, they're often giving all of their attention to the children who need it most. And sometimes the children who are getting on well are not getting the attention they deserve. So that's one element. We review every child every year with their teacher, and we then try and put a bespoke plan in place that addresses their strengths and their needs. Of course, there will be some children will need a more intensive review, and that's what we call an individual student review, where we bring in a wider group of professionals. And with that expertise and that collaborative approach, we try and come up with some specific goals, measurable goals, that we can set for that child. And I suppose the last piece that's really good about City Connects is there is somebody there to follow up. We can all make plans,
The accountability.
but unless there's someone there to follow
Yeah.
up to make sure the plan was put in place. Did it work? Yeah, great. Did it not work? Let's see how we can change it. So I think that is a quick synopsis of City Connects.
It's a brilliant initiative. So it's all the kids in these JESH schools that are part of the pilot project. What makes it truly unique is the fact that you're then connecting Dublin and Limerick with Boston. That might make some people nervous as to how you make a pilot like this work, but it is grounded for them. They already have the data out of Boston that shows this initiative. It's higher academic performance, it's higher attendance rates, lower high school dropouts, decreased chronic absenteeism. So they've proved concept in Boston, and hopefully Dublin, Limerick, Ireland is learning from that. But how has that worked, trying to do this literally across the Atlantic Ocean?
Yeah. Okay, I won't tell you a lie. When I started this job, my head did hurt from all the different partners, because we were talking about the Department of Education, we were talking about the Department of Children and Youth Affairs as it was then. We have Boston College. And then on the ground here in Ireland, we have Mary Immaculate College in Limerick, who are the lead implementation partner. And also then I'm seconded to TUSLA Education Support Service. And then we also have the North East Inner City Programme Implementation Board, who were funding it in the beginning, along with the Department of Children and the Department of Education. So how does it work? There are a number of oversight groups and governance groups, maybe too many. That one of the recommendations of the recent feedback and evaluation was that they need to be reduced and simplified. But at the beginning, they were necessary to get this off the ground, because it did involve a lot of steering groups, implementation groups, project management teams. But I have to say, it worked really well. It happened just in the middle of COVID, so we were all getting used to technology, maybe what multinational companies are used to doing all the time. So we were meeting on Teams, meeting on WebEx. Okay, you have to look at the difference of hours, the timing, the time zones. And then you have the added complication when the clock goes back in one country but doesn't go back to the other country at the same time.
Yeah.
But it worked really, really well. It's no substitute for meeting people in person. And I was fortunate enough last June to go to a programme manager meeting in Boston to meet Mary Walsh, to meet Claire, for all the team there. But it actually has worked extremely well by linking Athlone, Limerick, Boston and the North East Inner City of Dublin.
And I assume the hope and intention is that you're going to replicate what they have seen through the Boston example in terms of that scientific, evidence-based approach and outcomes. But it's going to be a long tail effect. This isn't going to be something we're going to see instantly through the school system here with these kids.
Yeah, you're right, Anya. I think that's why the first two evaluation reports are focused on the process, because for Boston College would be quite firm that if you want to see the same results, you must be faithful to the model. So we have to, and that's my job as programme manager, to make sure we are remaining faithful to that model, while also tweaking it to the Irish context, because we have to adapt any programme to the Irish context. And that's what the first 2 years have been about. But I am hoping that next year, the year after, we are going to see more of an outcome evaluation to show that the work we're doing now, the prevention, the enrichment, the early intervention work will, as you said, we're planting the seeds now to reap the rewards in a few years' time. But the evidence has shown that if you keep reviewing every child every year, tweaking the supports they're getting at different times as their needs and strengths evolve over time, if you keep tipping away at that, by the time the children do reach 6th class in Ireland, they're on a different trajectory, achieving all of the things you mentioned there.
How hard, or maybe not, has it been to get buy-in? Because this is so cross-functional. You're trying to get teachers, working with social workers, working with community leaders, working with youth workers. You need a political system and government departments to rise to meet the potential for this. And we talk all the time at this event about that need for cross collaboration and less competition and not be in our silos. Has that come naturally, or has it been you've had to build for that?
We definitely had to build for that. We definitely have. We, had to convince the classroom teacher that this 2-hour meeting at the beginning of a school year was worth it. And I think now every single one of them believe it is worth it because they get a chance to look at every single child. The principals are trying to say, look, we can take some of the work away from your desk. The homeschool liaisons who are already in these schools, we're trying to say, we can take away some of your work so you have more time to focus on your target parents, because this is not targeted. But then going out to the community, and I want to go back to what Arlene said about the children's voice. One of the things City Connects does every year is we survey the children of what their interests are. So we're surveying children from junior infants to 6th class. And I was blown away the first year, and the results were again the same the second year, of what those interests are. I would never have believed in the northeast inner city in Dublin, the number one interest was swimming. The second highest interest was Lego, arts and crafts, cookery were there. So by having that list of interests, we can then use that to approach the different community partners, whether it's Dublin City Council or whether it's a local youth club, and say, listen, this is what the children want. And I keep giving credit to all of the community groups in the North East Inner City. They have not been found wanting when they see that this is what the need is. We've set up successfully now 3 Lego clubs, we have dancing clubs, we have, we've a film-making club starting today or tomorrow, I think it is. So again, just based on what the children want.
Yeah.
And when you said, how does it all work and what's the secret to making it all work? If we keep the child at the centre of the room, I think at the end of the day, all of us want to improve their lives.
Great. Brilliantly said. I think you speak for everybody today on that one, Jerry. Our final speaker is Derek Chambers, before we come to your audience questions. Derek is the General Manager Policy Implementation with the National Mental Health Operations. Derek is leading out in the HSE's implementation of Sharing the Vision, Ireland's mental health policy. And Sharing the Vision takes a life cycle approach to policy with the individual at the centre at different stages of their life. Collaboration, coordination, as we've heard so much from everybody today, are key aspects to the policy and its implementation. Derek, I'm conscious, like a lot of people here today, you've got big long-term plans. In your case, it's a 10-year cross-government policy, 100 recommendations. You got this policy on your desk in 2020. You've really had to work through that to get to a point here in 2022 where you're into implementation mode. But can you talk about that whole part in the middle of getting buy-in from stakeholders, that you were setting it up for success, that you can now go and execute?
Yep, thanks, Anya. Look, really, really important question. So Sharing the Vision, as you said, was launched in the summer of 2020, and our first implementation plan was launched in March of this year, 2022. So in the interim, what happened? One of the main strengths of Sharing the Vision as a policy was that for each of the 100 recommendations, a lead organisation was identified. But in the case of 83 of them, the lead organisation was identified as the HSE, which obviously manages everything in relation to health services in Ireland, from the community to the acute hospital setting, and from prevention, early intervention, what we do in the area of bereavement support. So obviously, a lot of work was required in order to be able to be a bit more specific in terms of who was able to implement certain recommendations. And I think even more than that, and if I can zoom out for a second and just reflect on the actual title of the policy, it's called Sharing the Vision, a mental health policy for everyone. And it really is written as such. But then again, when it comes to operationalizing a policy, when it comes to actually implementing it and getting people to buy into it and take ownership of it, it can be a challenge to get people to think away from the tip of the pyramid, and Waddy referenced the idea of a pyramid in terms of support as well. Sometimes when we talk about mental health, the natural inclination, whether it's a member of the public or even people working within our health services, we tend to think about the tip of the pyramid, or we tend to think about the most acute need. And really, often when we're talking about mental health, we're talking about mental health difficulty or mental disorders. And that, for us, I guess, is one of the major challenges. And then again, reflecting on what people have said and reflecting on what people have talked about in terms of families and childhood experiences, we know from a lot of research that's been done in terms of the age of onset of mental health difficulties that up to 50% of mental health difficulties are onset by age 15, maybe 75% by the early 20s. And we also know about adverse childhood experiences and their impact on mental health in later life, and the importance of taking that life cycle perspective on things. So with all of that, I suppose that the job for us in terms of policy implementers is to try and get the wider public sector and the community and voluntary sector to take ownership of what has to be an entire cross-government national mental health policy. So that's the challenge that we had from mid-2020 up to March 2021. What we did was focus on each of the 100 recommendations. We drilled down into each of them, literally chased people to see if this was of relevance to them, if this was tying in with their work program, whether that was in housing or education or early childhood work. And we worked with people to say, look, this is our government policy, this is what the recommendation and the associated actions say. Can you work with us to develop a shared understanding so that we can actually implement it? So now we have that wider implementable plan that helps to guide our quarterly reporting and helps us to understand as to whether we're actually succeeding in the task that we have.
And as part of that consensus building, Derek, when you think now today about prevention when it comes to the whole area of mental health policies, what does that approach, what does that initiative look like in reality? Would you say, like we've heard from Wadid, the simplicity of the people, the person over the substances and that holistic approach. What does it look like in your area?
Yeah, look, if I can answer that in maybe sort of a philosophical way first, briefly, and then a practical way. It was, by listening to Waddy, I was thinking about the quote that is attributed to Eleanor Longden, the psychologist, and she talks about mental health and says that we need to change the question in mental health when we're thinking about people, away from what's wrong with you to what's happened to you. So I suppose that speaks to the importance of the wider environment, and Ciara has mentioned this as well, and people's wider life circumstances, because we're not, isolated biological entities. Our mental health and everything about us is influenced by what happens to us. So from that perspective, one of the 4 domains within Sharing the Vision is on prevention and early intervention, and within that, some of the key recommendations are about things like the education sector and the health sector and where they interact. So at a very, very practical level, recommendation 10 talks about the development of a protocol for the education system and the health system to interact in a more seamless way. Back to that word seamless and the idea of a seamless state. So it really is, from a prevention perspective, about taking a wider public sector approach to mental health as something that's not the sole responsibility of specialist mental health services.
And one of your newest initiatives, Derek, within all of that then is the mental health literacy campaign that you launched just last month. Can you talk a little bit about the goals of it and I guess the intended outcomes?
Absolutely. And we've been putting out public messages around mental health for probably since about 2005, 2007 now. So we have been campaigning publicly to speak around mental health and create awareness. Of course, there's no point in creating awareness without being able to signpost supports and services, so we did that as well. But just October of this year, we built on previous mental health awareness campaigns to launch a mental health literacy campaign. So resonating with one of the recommendations in Sharing the Vision, we launched Making the Connections, which involves additional content on the mental health pages on the HC website. So it's yourmentalhealth.ie, where we talk about mental health difficulties, not just mental health, but mental health difficulties in language that's accessible, so that it's a starting point for anyone who's beginning to be concerned about their mental health. So on it, we talk about anxiety, low mood, stress, and sleep as things that every human being can relate to. So it's not about thinking in terms of disorders, or it's not about pathologizing mental health difficulties, but it is about creating, I suppose, an entry point for people who are interested or concerned or worried about mental health, whether it's for themselves or somebody else. And the main objectives are to just give people that extra bit of information about something like anxiety if they're concerned about it, and to encourage people to know how to support someone else, or to get support for themselves as they need it. So it is whole population. I think it's really important that it is aimed at the whole population. And you mentioned Spun Out as well, and I know this is about children and young people. So what we're doing for the general population in that space would be mirrored to a large extent by Spun Out, who have contributed to one of your previous events from a young person's perspective.
It's great. Really important initiative. Thank you for that, Derek. I want to move now to your audience questions for our 5 speakers. And the first one from Kelly is just, again, this concept of the seamless state. And she writes, echo the points raised, read the Estonia example of seamless state. Services coming to the family rather than seeking, searching, begging. Families with children who have disabilities are in crisis and cannot access services, which undermines the principles of early intervention, as waiting lists can be well over a year to 4 years in some cases. How can we support families if the resources just aren't there? And to build on that question, though, where we kind of had started to land out with Ian from Spun Out on Monday was, okay, if we're going to kind of really embrace that idea of the seamless state and wrapping the right process and systems and structures around families so that they get access to the right supports at the right time, that we have to go back to this question of data. And does everybody need, a unique data identifier, which from birth, the system can then integrate, and you have that cross-functional nature, and everything is rising to meet you in your particular circumstances, the right support in the right moment. I'm not sure if anyone would like to go first, or Wadid, if you've seen any examples internationally of when we talk about that seamless state and making sure parents and people, young people, children, parents, their support groups have access to the right information and supports. If anyone has anything that they would build on it, because it's definitely been a theme that has cut through Monday and again today. Anyone want to go first? Give me a hand, or here in the room.
I can throw in
Please, thank
some
you.
insight to this. I mean, the context of information is, because services is at different levels. There are certain interventions, and there are certain things that essential information that the people should have in order from a health promotion or health prevention perspective. So the dissemination of information, the access to this information is important. Also, the importance of having the skills to kind of analyze information when it's only being filtered in, this critical thinking and kind of challenging misinformation as well is a key component. So while we're promoting, ease of access to information and ease of access to the knowledge, but it's also important to kind of that knowledge remaining, and this is the value of having like guests around the table, the entity being a trustworthy entity. When it comes to services or intervention, I totally agree with you. It's an important element to account for, and one element that has not been mentioned in terms of accessing services for us as United Nations is always we have the gender sensitivity of the response, where when we talk about prevention, girls and boys grow in different developmental trajectories and react to the environment in different way. Same thing with men and women. And that's why it's important as well when we're talking about this angle of accessibility is to account for like the population that is accessing this information, not in general also, but focus on the details of who's accessing these services. Back to you.
Great, thank you. Derek, you have your hand up, thanks.
Yeah, look, I suppose just specifically to the question, I do think we need to improve how people move between different parts of our services. And again, just reflecting on the question, whether it's disability services and primary care, or primary care and mental health services, the most important thing is that principle of getting the right support at the right time. And in all of that, obviously prevention is what everybody wants. We don't want to be requiring special services, or we don't. But the reality is that a very, very small percentage of people will require those special services, and how people move between those services is really, really important. So I think that's the spirit of Sláinte Care, the spirit of sharing the vision as well, is that we provide a layered care model of support that allows people to freely move between the different supports that they need at different times. But there's work to be done in terms of achieving that.
Okay, thank you, Derek. Arlene, you have your hand up. Thanks.
Yeah, thanks. I mean, I might just take it into the educational context again and go back to my point about, I suppose, that seamless journey for a young child as they move through the different parts of the education system. I mean, one of the pieces of work that we were involved in a couple of years ago is around the development of reporting templates, Muscale reporting templates. And their key purpose was, I suppose, to try and provide a mechanism for the sharing of information, particularly for young children when they would move from preschool into primary school. And I suppose when you think of that information, some of the key things that we were very focused on was what type of information is most useful, whose information is it, whose voice is in that information. So what we actually arrived at, and they're being used by a number of preschools and primary schools around the country. They're not used universally, but their use is increasing. And essentially information is being passed with parents' consent, information from the parent, information from the child, and information from the preschool practitioner. And it's all with a view to sharing information with the primary school teacher around, the strengths of each young child as they move, but also maybe the areas that, maybe need a little bit further attention and consideration as the child makes that transition. So I think that's just a very practical example in the educational context of just how important that transfer of information is to try and ensure that every child gets the best support that he or she can access as they move along that continuum of education.
Great. Thank you for that. Anyone here? You're good. I'll go to another audience question from Hannah from Alcohol Action Ireland. This is for you, Ciara. In general, she thanks everybody for a terrifically motivating event. Thank you for that, Hannah. And her question, we're hoping to see more development centred around children growing up with alcohol harm in the home. Are there any focused developments planned in early intervention for this key issue?
There's pieces of work happening under the National Drug Strategy, but I think we're very conscious that there are groups of children and groups of parents where we need further research and engagement to understand what type of supports they want and what would be useful. And and I think as Jerry's example highlighted, you can't always assume we know what the right response is. It does require that engagement and that greater understanding.
Okay, continual learning. Anyone want to add anything to that? Jerry, yeah?
Just to say a little bit about, there's in the North East Initiative there are a lot of services. We were talking earlier about how it might be difficult for parents to navigate that, especially when you have a language difficulty or you're living in homeless accommodation or whatever. So by having somebody there to direct the parent or to direct the child to the right supports, and just by looking at the number of referrals we made last year in City Connects, 66% of the referrals we made were prevention. 24% were early intervention. So yes, there is a small number that need that intensive, but to think that nearly 94% or 92% were in the area of prevention, early intervention, I think says a lot. And that wasn't by intent, that's just, but we feel that by getting kids involved in football or getting them involved in dance or getting them doing something they like to do, we're hopefully going to avoid that number progressing onto the issues with drugs and alcohol and so on in the future.
Great, thank you, Jerry. Wadid, if it's okay, I might give the final word to you, having listened to Derek, Arlene, Ciara, Jerry today, just with your international lens, looking at all of the Irish case studies, examples, insights. Just if there's any final insight or a takeaway or words of wisdom or encouragement or a call to action you'd like to leave us with.
that's too much pressure on you, but it's already really important in the field of prevention to reflect the fact that there is a science in prevention. There's a lot of things that can be done. I know that there is room for innovation, but innovation has to be within the context of science. But while the several tools are in existence in terms of demonstrating their effectiveness, having that sort of discussion with policymakers, because there is difference between having the ingredients for prevention versus having a system of prevention in terms of integrating services and having the pieces of the people working in prevention really have the same vision in terms of what prevention is and what is needed for the healthy and safe development of children. And that really requires not only availability of science-based intervention, but quality of delivery of these services, and also professionalization of the workforce that is linked to prevention that we aim for. And I think now we're at a stage in the science of prevention that all of these elements are there. It only requires the will of the policymakers and the financial commitment of the policymakers really to kind of really value prevention, because I think the context of COVID-19 now has taught us a very important lesson in terms of how much prevention can save lives, millions at a time. And also at the same time, the disadvantage of or the side effect of COVID-19 have digressed the attention of policymakers into quick economic recovery measures rather than just focusing on this human development issues. And I think this discussion today really will bring the attention back on the value of such intervention for development.
Very good. Very, very well said. Thank you for tying it together so well there for us at the end. That was Wadi Mahmood from the United Nations Office on Drugs and Crime. Our thanks also to Ciara Pigeon, Principal Officer, Department of Children, Equality, Disability, Integration and Youth, to Arlene Forster, CEO, National Centre for Curriculum and Assessment, Jerry Cullen, Programme Manager, City Connects, and Derek Chambers, General Manager, Policy Implementation for the National Mental Health Operations. That's all we have time for again today. That was the second of 3 events this week as part of the What Works Festival of Learning. We're back here tomorrow again at noon. The recording of this conversation on Mondays will be available shortly on the What Works website. Do sign up on the website for tomorrow's final session. This conversation, the entire event, was made possible by the Department of Children, Equality, Disability, Integration and Youth, who worked with the Centre for Effective Services to make it all happen today. Our thanks again to you, our audience, for your questions, to you, our speakers. Thank you so much, and we'll see you again at noon tomorrow, Dublin time. Thank you.